Today we'll talk about Toxoplasma gondii. It belongs to eukaryote domain, a single-cell organism that contains a nucleus and has membrane-bound organelles. The name Toxoplasma is derived from brickwork, meaning odd-shaped organism. Under the microscope, it has gram-positive purple color stain. It is an protozoan parasite with highly developed structure at the interior region, called apical complex. It's like a drill structure which used in host cell invasion. Although it has no flagella or cilia, the gondii can move by cell crawling technique, which is suitable for morsel into and between host cells. The gondii parasite is found throughout the world. More than 16 million people in the U.S. may be affected. The disease called toxoplasmosis. It has very few symptoms and hard to be recognized because healthy people, the immune system usually keeps the parasite from causing illness. However, when the immune system becomes weaker, like in infants, older people, pregnant women, and patients with no immune system, could cause serious health problems. Toxoplasma gondii was discovered in 1908. It was identified in North American rats as being used for research in Pasteur Institute in Tunis. For the ecological role, it has no known adverse effect on the environment and does not participate in any biochemical synthesis that activate, disrupt, or positively contribute to the biosphere. Its main effect is on the individual level. As an obligate intracellular parasite, it targets mainly warm-blooded vertebrates as its host. No known symbiotics between T. gondii and other organisms has been observed. The complete life cycle was then examined not until 1970. Toxoplasma pathogen can only finish its life cycle once it gets into a cat body. When it's inside the cat, the T. gondii spore enter intestinal epithelial cells. Being an obligate intracellular parasite, it absorbs nutrients, especially glucose, in the intestinal tract. From there, it's like to be spread to other parts of the cat bodies, like muscle, brain, lymphatic system to get the nutrient in living cells. Toxoplasma also has some amazing adaptations for hiding inside the host cells without causing too much harm while waiting to be ingested by its secondary host, which is the cat. After ingestion, this organism releases a compound that boosts the number of T cells in the host body. This makes every macrophage in the body an effective toxoplasma killer. Only those toxoplasma that hide inside the cyst will be safe from the immune system response. To manipulate the immune system of the host, the parasite won't overtake the host body, prevent from killing the host. T. gondii's most amazing adaptation is its ability to change the host behavior. When this organism exists in a mouse, it will actually cause the mouse to be less afraid of the cat smell. In some cases, mice infected with Toxoplasma will actually shit out cat smell and stay in the area for long periods of time. Under normal, uninfected circumstances, mice go into the panic when they smell cats. After smelling the cats, they learn to stay away from the area where they experience the smell. After infecting with Toxoplasma, These learned behavior change so that the mice are no longer afraid of the cat smell. This means that T. gondii affect the mouse brains so that it's easier for the mice to be eaten by cats, which are the secondary hosts that T. gondii needs. When the infected cat extracts the pathogen as oxide in the feces, other warm-blooded animals like human, birds, rats can also become T. gondii intermediate hosts. It can spread through food chain cycles, undercooked meat, water contamination, or vertical transmission from mother to child. Even when the infected feces with Toxoplasma cells bury outside in the environment, they are very tough, resistant to harsh temperature conditions, and can live for many years. So what should people know about this organism? The microbe referentially insists itself within the tissue of the brain and the central nervous system of the host, causing effects in the brain function. Because this pathogen can only affect human hosts with low immune system, a healthy person who is not pregnant, treatment is usually not needed. If the symptoms occur, they typically go away within a few weeks to months. And yes, it's similar to the cat, so they do not need to discard your cat. Before planning to become pregnant, you can ask your healthcare provider to take toxoplasmosis blood test. If the test is positive, it means you have already been infected sometime in your life. There's usually a little need to worry about passing the infection to your baby. Or if you have a weakened immune system and your test is positive, your doctor can tell you if and when you need to take the medicine to prevent the infection from reactivating. If the test is negative, take necessary precautions to avoid infection. To prevent toxoplasmosis, don't consume undercooked meat, oyster, mussel, or clams. These may be contaminated with toxoplasma that has washed into the seawater. Peel or wash fruits and vegetables thoroughly before eating. Wear gloves when gardening and during any contact with soil or sand because it might be contaminated with cat feces that contain toxoplasma, and of course the importance of washing hands to prevent the infection. And finally, thank you for watching.